Thank you, Doctor. Thank you. And now it's the time to start the international session. Today is the 1954th day of uninterrupted daily webinar of IFPH. Before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1954th day of uninterrupted daily webinar of IFPH. And today, our guest is Dr. B.R Bindu, Center Head, Vidyadhiraja Neurodevelopment Center. Dr. B.R Bindu is a lecturer, Department of Organ on Sri Vidyadhiraja Homeopathic Medical College, Trivandrum. And she's having her clinic address at Prashant Nagar, Ullur, Thiruvananthapuram. One of the experts in the management of autistic spectrum disorders. She do have 22 years of clinical experience. Dr. Bindu is having another 21 years of teaching experience. And today is the second part of the series, Scope of Homeopathy in Neurological Disorders. Let me welcome Dr. B.R Bindu for the session, and I welcome you all for the session.
Thank you, sir. Thank you for the kind words. Sir, unfortunately, my video is not responding. Hope you can see my screen.
Yes.
Okay, so today I am dealing with some of the neurological disorders where we may be confused. Like it's very similar to the autism and other neurodevelopmental disorders. But why I took this topic, because many of us are now having many cases, autism cases and neurodevelopmental cases are approaching us. So we may be confused whether this is an autism case or not. So without wasting much time, I'm going into the cases in detail. If it's not visible, please let me know. So today I have selected 4 cases, among them Rett syndrome, Glass syndrome, and infantile Parkinsonism. So in Rett syndrome, we will be dealing with 2 cases, and 1 case of Glass syndrome, and another one is infantile Parkinsonism. All of them are like genetic mutations, but very similar to other neurodevelopmental disorders like autism and cerebral palsy and all. And so first of all, we will start with Rett syndrome. So Rett syndrome is a condition where usually it is when we select for this, when we select for research and all, we will be excluding this Rett syndrome from autism because it's very similar. The speech will be, communication will be absent, and the social interaction will be absent. But the thing is that they will be having continuous seizures. And Rett syndrome, coming to Rett syndrome, it affects only the girl child, not found in any male child. And this causes a loss of motor skills, and there will be continuous seizures will be present, and mouthing is one feature of this Rett syndrome. It's a very rare condition, and it's a developmental disorder, and progressive loss of motor skills and language will be there. And in this Rett syndrome, actually the development will be like autism. In the early stages, development will be normal, and slowly there will be regression of development, especially the speech. Rett syndrome is a progressive neurodevelopmental syndrome. It's a progressive, like it is found in 1 in 10,000 or 1 in 15,000 live female births. That much reduced is the incidence, but still we may get it. So we have to understand that. We know it's MECP2 gene located on X chromosome. It is linked to this mutation of this particular gene, but we won't be knowing all these things because we don't know what is happening in the genes and all. But the presenting complaints, from the presenting complaint itself, we should suspect that it's a case of Rett syndrome. Usually, there will be some or other changes in the head size. It is microcephaly is seen in many of the conditions. Microcephaly means small head compared to the circumference. Head circumference will be low. And this gene, MECP2 gene, plays a vital role in regulating neuronal maturation, synaptic plasticity, and gene transcription in the developing gene. And it's not always like seen in inherited and all. It can be it can occur at any time, even like in the formation stage of an embryo, like in the sperm or in the egg. So since it is affected in this mutation occurs in X chromosome. And clinically, Rett syndrome is characterized by normal early development. As we all know, in autism also there will be normal development. Most of the time, there been regressive autism is more common. Similarly, here also in Rett syndrome also the growth will be normal, and between 6 and 18 months there will be regression of development. In autism also, what we see is in 18 months or around 24 months, that is 1.5 years to 2 years, we find usually there is a regression in speech and all. So it's very similar. The hallmark features is loss of purposeful hand movements. This is particular to Rett syndrome. So if there is a case of it is, if like we are suspecting Rett syndrome, this is a important feature, that is loss of purposeful hand movements, and they will be always keeping things in mouth. Mouthing is an important feature of Rett syndrome. And but others like stereotypic hand wringing or washing movements or that may mimic the autism symptoms like flapping and all, repetitive movements and all. We may think that that is the autism symptoms of like repetitive movements, but here it is particular like wringing or washing movements. And there will be like regression, deceleration of head growth means microcephaly, and motor incoordination will be there. These children have difficulty in walking and all, loss of balance and seizures and communication difficulties. These communication difficulties, repetitive movements, and all regression will mimic autism. Despite severe impairment, affected children often maintain social interest and emotional responsiveness towards family members. Even though these features of autism remains, they maintain a social interest. Like they will be playing in park and all with even if other kids are playing and all. But that we lack in autism cases. So coming to the cases, first case, 3 year and 8 month old female child born to non-consanguineous parents. When we take these neurodevelopmental cases, we have to ask whether the parents are of relatives, to avoid like such conditions. Few conditions are inherited. So in order to rule out that, we will ask that. And the child used to say amma, acha, and like call the parents by name and all. And there was marked delay in the walking, and there was poor eye contact and inability to grasp objects and inability to sit without support. But she responded to sound and familiar faces, sound especially of familiar faces, and reacted when called by name. The mother reported that she was frightened by sudden noises and vibrations. And 2 months prior to consultation, she had episodes of seizures and is under allopathic management for that. She also had cough since that is 2 days, that is an acute complaint. And coming to the other history, like birth weight was 3 kg, and the neonatal period was complicated with mild jaundice, requiring NICU care for 2 months. The mother's antenatal period was uneventful, and the child had normal development initially, but exhibited growth retardation and regression of milestones. Around 2 years of age, she lost the previously acquired speech and motor coordination. That again mimics autism. And you know that in Rett syndrome, usually the child will not, the girl child will not attain puberty. That is the prognosis of the case. The child has in continuous neurological and need rehabilitative care and all, because they may fall due to incoordination. Family history, a strong familial predisposition for metabolic and cardiovascular disorders. Maternal history, family had diabetes mellitus, and paternal grandparents had hypertension. Nothing relevant to this. Mental and emotional, like the child, she was very affectionate towards the grandmother and attempted to communicate through nonverbal cues. She exhibited fear of loud sounds and was often frightened after bowel or urine evacuation. Irritability was observed when parents failed to understand her needs, occasionally leading to biting or hitting behavior. These biting and hitting behavior, when the others fail to understand, is common with autism also. That is very common, and that is the main thing why these autistic kids become violent and abusive. And generalities, she preferred sweet and tasty liquids and had a desire for fanning. She tended to be constipated when unwell, with sweating on the back of the head, and was attached to father and will get disturbed if he is not there, and also to the grandmother. She was very attached to the grandmother. And based on this, the diagnosis was confirmed by genetic testing. So if there is any case like this, it is a girl child, and if there is mouthing, uh, lack of coordination, and repetitive ringing movements and seizures, please refer to some like genetic expert in Trivandrum and all CDC. They do Dr. Shankar. I usually refer to him, and he is very open to homeopaths also. Sir will return back with the comments, what he observed and all those things. So similarly, we should identify someone who is doing with like working with molecular biology and this field, that we need always. And the medicine prescribed was Calcarea phosphorica because the child was chilly. And based on the, I usually prescribe Calcarea phosphorica where the child is too close to at least one person and they get disturbed, especially in neurodevelopmental disorders like autism. They don't show affections or emotions, and uh, they detach from others, and they will be in their own world. So these kind of symptoms, like the showing affection to a particular person, and when they get disturbed if they are not around and all, it have a very high significance. And with and other generalities, if they agree, I prescribe like calcarea phosphorica. And in this case, calcarea phos 6C started with. In Rett syndrome and all, I usually start with 6C because continuous seizures will be there mostly, and the incoordination and all. So I started with calcarea phosphorica and 6C. First in the repeated dose, like 2 drops in 6C, 2 drops in 10 ml aqua, and again the diluted dose 2 drops every 1 hour for the first day, and second day 3 hours, and third day onwards 4 times daily. And it will go for 2 weeks like that, and then make it 3 times daily for 2 weeks, and then 2 times daily. Then go for 12C, similar repetition, and then 30, 200 likewise, single dose. And now it reached, I think, one number 10 num. And the child improved with the absence of seizures and better hand and high coordination. She used to take food by herself, and now she's not afraid of, like, she's not crying after stool and all. Now the second case, Rett syndrome, and unfortunately, it happens on and off. That usually I don't get the same medicine for the single condition, but in this Rett syndrome, both the cases were of indicated calcareous. Here, 4-year-old child, uh, single child of non-consanguineous parents and with diagnosed Rett syndrome. Birth weight was 3 kg and she was delivered after an uneventful pregnancy. Why uneventful pregnancy is important? Because no, in like you know that during delivery or if there is these neurodevelopmental disorders or neurological disorders in children usually occurs due to hypoxia, low oxygen to the brain, or because of hypoglycemia. If the mother is diabetic or had gestational diabetes, then the child may have hypoglycemia. So that may cause, that is another cause for neurological or neurodevelopmental disorders in children or infants. And another one is like hypovolemia, like transport of blood if the blood to the brain is low. So we have to ask about the antenatal, prenatal, and postnatal history. And the child presented with multiple seizure episode with the regression of speech, loss of motor coordination, and behavioral issues. Seizures were characterized by head bending, shaking, and staring spells, which had been occurring for the past 1.5 months. The mother reported with difficulty in walking, lack of stability, poor eye-hand coordination, leading to difficulty in holding objects. The child was more non-verbal but responded to familiar family members and using non-verbal cues only. Involuntary bowel and bladder because and like involuntary bowel and bladder control. Actually, she won't indicate for bowels or urine, and she often appeared frightened after elimination. The child was born at term, birth weight 3 kg. Early milestones were normal. However, at 4 months, small lesions appeared on her leg and hand, and she developed infantile spasms for which pyridoxine and vitamin B12 were prescribed. Second seizure occurred at 9th month and diagnosed as febrile seizures. And child received homeopathic treatment until one of our senior doctor only referred this case to me and uh, then with homeopathy, like after coming to me, I have assessed and it was improved. Like now the child is not having any seizures and she started walking also. At around 2 years, her speech was regressed and she could initially say about 10 words but gradually lost the ability. And she was evaluated at Niche, Trivandrum, and where she was diagnosed with speech delay and started therapy. And from 2.5 years till last 3 months, she continued speech and occupational therapy, which helped reduce irritability and behavioral issues, particularly in crowded places. These irritability in crowded places are also common with autism spectrum disorders. And patient is on 2 allopathic medicines for seizures, including Levipil. And homeopathic care, I started Calcarea 460. Even with allopathic medicine, 2 allopathic medicine, she was getting seizures. She was affected with seizures. But after starting our medicine, uh, the like family history and all, the maternal grandfather had diabetes mellitus, hypertension, and hyperlipidemia. I am not going into that details and all. We have to take the entire case as usual in a homeopathic way. And the emotional and mental status, there will be irritability, especially when her same thing like in autism, similar here also. So you can see in both cases this is present, like, similar features of autism. When they are communicating, and if the other person is not understanding what they are conveying us, they will be angry or they will be irritated. And the generalities here also, like when she has pain and all, she usually point towards abdomen, showing that she is having abdominal pain and all. Desire for chocolates and all, and she was also attached to her mother. I think she was very attached to her mother, and she was very disturbed if the mother is not around her and all. So that emotional attachment and desire for chocolates and all those things made me prescribe calcare 6C. And she also improved with improvement in lack of seizures or absence, complete absence of seizures, and improvement in walking and the better eye hand coordination and all. And started a response to family members. And now their parents were able to take her to the public, even in crowd and all. And the crying spells after bathing and after moving bowels and all, it reduced. So it's a lifelong disorder requiring integrated medical and supportive care. So always uh, advise them for the supportive care like speech therapy and other therapies along with our medication. Now the third case is glass syndrome. Glass syndrome is also a rare condition where we won't be suspecting anything, because during the pregnancy time and all, there will not be any signs. Everything will be normal. The SATB2 is a gene affected. It's associated syndrome. Here, the protein function and neuronal development is affected, and because of that, it leads to developmental delay, hypotonia, intellectual disability, and craniofacial anomalies. These we have to always see. If you have a case of neurodevelopmental disorder, just look at the face of the child. If we something abnormal like microcephaly or any facial disfiguration and all, send them for a genetic evaluation. That's exome sequencing. Send them for exome sequencing. Writing a letter like having this dysmorphic features and microcephaly and all, and developmental delay. Kindly assess like that. We have to refer, and when it is done, we are like we can confidently move on. And in this case, actually, uh, they didn't know like it was a glass syndrome case and all. We have, and our college is having an MOU with the India University Center for Biomedical Research, and they collected the sample, and this case was diagnosed with a variant of diagnosed as a variant of glass syndrome, and they have published this in Clenvere Laboratory, Clenvere Digital Library. That is a library, digital library where all the rare diseases are recorded. In that, this particular mutation or particular variant of glass syndrome is mentioned, and they have mentioned my name also, included my name also in the publication. So, because the case, from our case only, they got this variant. And the mutation is in SATB2 gene. In this case also, there will be lack of movement. Like she was not walking properly. She used to fall continuously, and there was a developmental delay and hypotonia and intellectual disability also there, and all her craniofacial anomalies, including a like sorry, invert, like her face have a particular, like I will be going on to the picture of the child with their permission. After taking their permission only, I am exposing the child, and there she had multiple like teeth anomalies. That is also common with glass syndrome. And so the case is like this: 3-year-old female child presenting with delayed walking from 1.5 years of age, recurrent respiratory infections, poor oral hygiene. Drooling was there and it was very offensive, and there was balance disturbances. She was not able to walk without holding and all. Very difficulty. She walked with very difficulty, and there were fear of toys and all. Family history was significant for neonatal death of a sibling due to respiratory distress, metabolic disorder in another sibling, paternal grandmother with cancer, and father recently diagnosed with leukemia. Genetic confirmation, because when we send for genetic confirmation, they usually ask for whether there is any MRI or EEG changes. In some case of neurological syndrome, the MRI also show various anomalies. We have in some other presentation, I will present one case where the corpus callosum is completely absent. And the result, like homeopathic medicine, the medicine was given, and medicine given was creosotum. Indication was she was having like desire for sweets, and the offensiveness of discharges were there. And another is that in acridity of the nasal discharge and all. And she liked sweets, and the irritability of mood were also there. So based on that, I prescribed creosotum, and this was her face. See her nose and all the like widely separated eyebrows, and you can see an like the head is usually small and all. See sharp. Sorry. In this video, you can see that she started walking. Earlier, she was not able to walk without support and all. It was with very difficulty. So now she is able to walk. She started responding with small words and all, and the irritability has reduced. The drooling has stopped. There is no seizures and all. So overall improvement is there. Now it reached up to 50, I think. Now the other case is infantile Parkinsonism. This is the last case. This also is an inherited neurological disorder starting in infancy. There will be progressive movement issue like tremors, and the child will not be able to stand or walk, and there will be slowness of movements, and rigidity will be there, and uncontrollable contractions. Here it can mimic cerebral palsy. Uh, and in like cerebral palsy, the movement is more affected. In this, what happens is it's also known as infantile Parkinsonism is also known as infantile dystonia. Here, the dopamine transmitter deficiency. It's also called dopamine transporter deficiency syndrome, because dopamine transport is affected by this gene. As we know that similar thing happens in adult Parkinsonism also. So usually in early infancy, with irritability, feeding difficulty will be there, hypotonia will be there, and motor symptoms like tremor, like in Parkinsonism, slowness of movement, stiffness, and tremor will be there in children, this infant also, and dystonia, that is sustained and involuntary contractions. Other symptoms are poor balance, impaired coordination, developmental delay, and abnormal eye movements. Sometimes recurrent pneumonia also occurs. Epilepsy and like in worsening dementia and epilepsy. But in this case, there is no such thing. And genetic base, it is autosomal recessive and mutations in SLC 6A3 gene, which codes for the dopamine transporter. And the case is like 3-year-old male born to co-sanguineous parents. They were relatives actually here. In this case, the parents were relative and diagnosed with infantile Parkinsonism. Delivery was normal, full-term delivery, weighing 3.5 weight 3.5 kg. Milestones were delayed and walking delayed, especially with toe walking. So toe walking mimics autism, and also difficulty in talking were there and difficulty to understand comments. So comprehension also difficult, where it also mimics other neurodevelopmental disorders like CP, cerebral palsy, and autism. There was drooling of saliva, and he was very reluctant to take food and covers the mouth. And 4 months are in this suddenly, like this, they told that the movements were not much reduced, but after vaccination at 4th month, it occurred suddenly. So that was a striking point. And when I took the generals, like he had aversion to covering, and there was intense desire for sour things and all. So, and I selected Medorinum 50 one pill was given, and after 1 month he started walking. So that was surprising for us. This was the video before we started medication. He was not able to stand or walk. He was crawling like this, but he was not able to walk at 3 years of age. This was under like after 1 month when he visited our clinic. In this case also, you can see his face has some or other abnormalities. He is not looking like the normal child. So whenever you see such a case with an abnormal facial features, and there is developmental delay and all, please refer the patient to a for genetic evaluation, and it will help us identify the real condition, and that will also add like our not only our confidence, but also we will get the support of the evaluators, like those who are doing this genetic array and all. Similar, I got another case where the proper diagnosis has to be made. Till now, proper diagnosis is pending. That it occurred in like it's a very poor family. Both child is having the similar difficulty. That no, the children were normal till 2 years of age, and then suddenly one day the elder child, it occurs like she fell down one day, and after that she lost complete mobility and also the speech and all. And with Ayurvedic treatment, she improved little bit. But when we started medicine, now she is able to walk properly, and she started uttering words and all. So the similar thing happened with the second child also. She was normal till 2 years, and then one day suddenly she stopped walking and all. Now completely bedridden. Now she is trying to rise like by herself, and she is sliding from the bed and all, trying to get out of the bed and all. So in all these cases, like it mimics neurodevelopmental disorders, but it's not definitely a neurodevelopmental disorder, but is having some or other association with genetic conditions. So kindly refer at proper time and get it diagnosed, so that our knowledge also improves, and also uh, we can have a better confidence that we are doing something great. Like in such cases also we can do miraculous changes. So with that, I am ending my presentation. If you have any doubts, we can go into that. Because it was in a hurry that I was confused. Like yesterday only, the sir told me that to present today. So today I had OP and consultation, and also I was very we are all in expecting a inspection, and also little bit hurry. I only selected few cases, and if you have any doubts and all, please uh, ask me, and if I am okay, I will answer. And if I anything which I don't have, no, I don't know, I will refer and will come into it, that.
Okay, okay, doctor. It's a great motivating presentation, and after a hectic schedule, you came and presented this. We had cases on Rett syndrome, glass syndrome, and we had a case on infantile Parkinsonism. And you mentioned the importance of referring the case and get it diagnosed, the differential diagnosis we need to find with the help of other persons. And please, you can repeat that to CDS you are sending these cases, isn't it, doctor?
Yeah, see, it is Child Development Center in Trivandrum. There, Dr. Shankar is very open, and I am referring to him with a letter writing all the symptoms and what I observed in the child and all, like the dysmorphic features and all. And then he will be doing all these things. And in CDC, it's I think the rate is very low. Usually exome sequencing require, I think, 25,000 or something like that for the complete sequencing. But in CDC, it is low. So we can refer to government institute, and persons like Shankar sir is very helping.
So we can refer directly to this Dr. Shankar itself, or we need to write to some other authority in CDC?
No, sir, no. We can directly send to Dr. Shankar, writing a letter to Dr. Shankar and all.
Okay. So in these cases, we also need other teamwork also for the upbringing of this child, isn't it?
Yeah, physiotherapy, speech therapy, occupational therapy and all.
Okay. So this are you incorporating in this neuro?
Yes, sir, definitely. Actually, we have in our college neurodevelopment center, and in our center itself, we are giving speech therapy and special education and all for these kids. And physiotherapy unit is also working in our college. But unfortunately, occupational therapy yet to get. For that, we are referring to like any of the centers, government, many of the BRC and urban rehabilitation centers and all, they have all the therapies. So we can refer to the local rehabilitation centers also.
Okay. So in autism spectrum disorders, homeopathy is can do wonders. I think with rightly selected homeopathic medicines and well aware, the physician should be well aware on the how to interfere, how to diagnose the case, and how to evaluate and distinguish the common symptoms of the case and differentiate it from the particular generals or the cardinal rare peculiars, that only we can select the medicines. Otherwise, we will get confused from the common symptoms of these diseases, isn't it?
Yes, definitely. Because no, what I observed is usually if we go behind the repertory and selecting medicines on like monosyllables, using monosyllables, head banging and all, no, we won't move further. Like we will get stuck at a particular moment addressing those symptoms only. But if we select avoiding all these symptoms, and we select on a general on the generals only, we can move further, like all areas will be improved. You know what I told, like in Indian Inter-University Center for Biomedical Research, they are cooperating with us, and they are basically neurochemists. And they observed that changes in all, like around 120 cases or so. They collected samples from the patients in coming to our OPD and all. And they observed, they are assessing with CAR scale. And in that, they observed the change is remarkable in all the fields of CAR scale. In all the 15 areas of CAR scale showed improvement with homeopathic medicine. And I am prescribing, I am giving only one pill in my OPD to just to show that teaching, that teaching organon, advising them that single pill and all. So I want to show my students that it is working. And we are doing that only and seeing this by the scientists also and observing the changes in the CAR scale. They were so wonderstruck and they wrote and now they only recorded an article. They only presented with what do you say, that graphs and all the changes they recorded, behavioral manifestation changes with the homeopathic medicine. And their presentation only I presented in a Malaysian conference. It was done by in coordination both with their support and by using our patients. And now the head of that department, Dr. Usha Rajama madam, she is working in autism. So she is writing, and actually I think she sent it also to an international journal Journal of Autism, uh, a review, a systematic review saying that homeopathic medicine is showing improvement in autism spectrum disorders based on their evaluation and all. She has written an article to International Journal for Autism, yet to be published. So such things should happen. If we collaborate with such people, scientists and all, we can definitely move forward. But for that, and with that, we are proving that our principle is right. Because they are seeing, they ask me every time, they ask me which medicine you have given and all those things they ask. So all these cases are showing different medicines, no? Around 20, 25 medicines or something comes. So that again shows that our principle is correct. Like it's not, we are not treating a particular condition like autism. We are not giving specifically for autism and all. We are giving for the patient. So that is proven. So scientifically proven with their evaluation. So we can do such things.
Excellent and very promising. So it's time to interact with the speaker. You can raise your hand or comment in the chat box. Another 15 minutes to go. And it's very saddening that about 360% increase in autism spectrum disorders is there, I think, on the statistics. And it's very much annoying, very much disturbing. And after vaccination itself, all suspects is on vaccination. And what is your take?
Sir, during my PG, like I was also in an opinion that this vaccination is the real culprit. But when I read the so many articles as a part of review of literature for my PG thesis, uh, it can be, but not sure because no, this in autism and all, these presentations will come only after 1.5 years or 2 years, like 1.5 to 2 years, usually present with regressive autism and all. So this 1.5 years is the usual period for MMR vaccine and all. So at that time, we may be confused whether this MMR is the culprit or any other condition and all. It's not definitely because of this vaccination, but I think it has a role. And To my knowledge, Dr. Shahnas Ahmed, he's a pediatric neurologist in Government Medical College. Sir only referred cases to me for the first time and all. So, so in his opinion, he actually tell directly to the parents not to give vaccination. He says that vaccination, due to vaccination only it occurred and all. Sir is very famous pediatric neurologist, and his son is also autistic. So I'm still not sure that it is the real culprit or not.
Okay. And the other thing is, there is some emerging frontiers on the gut microbiome back with these autistic disorders. And improving the gut microbiome is also giving some benefits. Can you comment on this?
That also I have gone through the articles during literature review and all, and still following that. But so many studies still going on for a definite cause for autism, yet not getting an marker or anything or a particular cause on autism. But yeah, what I understood is that these children, autistic children, are more prone to allergy and all, and gastrointestinal disturbances are also common in these autistic children. So if they are fed with probiotics and all, these are addressed to a certain limit. So definitely gut microbiome has a role. Like today also, I have discussed that in my class, during my classroom in my with my students, that we have to look towards that, because no, that latest studies are showing that the meconium of the uh, infant or the newborn is taken and preserved for this gut microbiome analysis and all those things as a future study and all. So, and it is showing, and the studies are there showing that this gut microbiome has a definite role in the constitution of a person, like the characteristics of a person, or the general improvement of immunity and all. So many studies related to gut microbiome is there. So what I think is that maybe because of that, we are also giving orally medicines, no? Our medicines are acting as in the digestive system also. So is that because our medicine is acting on the gut microbiome, we are getting all these results? Like, we are not giving for an allergy, we are not giving for autism, or we are not giving for the headache and all, but still it is addressing the person as a whole. So these studies again point towards what our medicine response and all. And I think gut microbiome has a role, but what they think is not in the right direction, because they are thinking that gut microbiome, if it is okay, it is addressed. But the not all the symptoms are addressed, but this allergy aspect is addressed with probiotics. That is my observation, sir.
Okay. And I also found on some prescription of Dr. Shahnas itself that he is frequently prescribing this black seed oil for these autism spectrum disorder children. And I think they are also just watching the efficacy of these type of things.
Yes, sir. Shayana Sarman sir is actually prescribing more on minerals, generally minerals, probiotics, and all those things. He never, rarely gives medicines. He is giving probiotics and all.
Doctor, another thing I noticed is that for seizures or acute manifestations of this Rett syndrome, you are frequently giving these lower potency, centesimal potencies for the cases. And do you have any other experience with this 50 millisieverts on these cases? For frequent repetition, isn't it beneficial than centésimals?
Sir, to be frank, I am not confident with the 50 millismol potency, and I don't know how to follow up with the levels of 50 millismol. So I avoid prescribing that, because what I don't know, I don't want to, like, with my, due to my law knowledge or deficient knowledge, I don't want to spoil the health of the children, because no, what I understood that in 50 millismol, towards the end only the homeopathic aggravation comes, no? So if I am not that much familiar with the potency and the repetition and all, if I miss that aggravation and all, uh, for the time being, at least the children will suffer. So I don't want to do that. Because of my lack of knowledge, I am not trying 50 millismol.
Thank you for your kind answer. And I think for a good doctor, potencies and dose selection are just tools, and you are gaining good results on this itself. So we'll also follow suit. And here, Dr. Dhanesh Jasimhan is going to join with us. Doctor, please. Dr. Dhanesh. I think he has some network issues. Doctor?
Yes, I have some data. Dr. Bindu, it's really very good session. You show the beauty of homeopathy in treating such neurological diseases. But unfortunately, most people don't have the awareness about this kind of treatment from homeopathy for this kind of diseases. What we need is we will have to make a lot of propaganda in a positive way to do wonders in such incurable cases, the so-called incurable cases. That I must say, most people believe that once this kind of disease happens to a child, it will last for his death. And that is what the other system, they just manage, and they just do a lot of things for the child, but the medication can do only a little bit. But problems, we can manage the patient in a better way if we get it in the younger age. That means as early as possible. But most of them go to the other side and come back to us very late. And by the time the case may be spoiled. What's your opinion on that, doctor?
It's true, sir. Actually, they don't know. If we have such a child, we understand. Like, whatever we can, we will do. No, we will. Even if it is a black magic, they will go for that, because first of all, it's very difficult for the parents to accept that their child is autistic or having such a difficulty. So that is the main that is a difficult part, that we have to convince them regarding this. Your child is autistic or having neurodevelopmental disorders, so that it will that itself will lose the years. Once they get convinced, only they will take for treatment. So around early years with delayed milestones and all those things, they will wait, because their grandparents were like this, someone in another family was slow in speaking, and someone other was slow in walking, and also we will wait, let us wait, and all, they will wait like that for years, and then they will start they will take for an assessment. Once the assessment is done, then it's very difficult for them to accept, because they think that no one in the family is having such a thing. Why this happened to me? I haven't done anything wrong. Such things goes for some time, and again they lose 1 or 2 years. Then they will start with the therapy. But by that time, if the child reaches above 5 years of age, no therapy can help. Like limited therapy after 5 years, limited scope for therapy after 5 years or 10 years at least. 10 years we can do something or other. After 10 years, most of the therapists will say that nothing to do with the therapy and
we
all.
need to get
Now,
the.
and then only they will think of the other systems of medicine. So slowly they will come to us. But sir, what in my experience, I think I am now it's more than 700 cases. So now in my experience, I can say that confidently say that whether it is 56 years, whether it is 3 years, we can do miracles with homeopathy. Only homeopathy can do. And with like even if it is in smaller age, like 2.5 years or 3 years, within 6 months we can move them out of the spectrum, or at maximum 1 year we can move them out of the spectrum. But now they are coming, like as soon as they get diagnosed, they will search the web and go to YouTube and search and all. Then now they are coming to us at an early age, so it is promising.
Yes, Doctor. One point I would like to add is that you just told about you are not taking any LM potencies here, but that's a good idea, because if you get successful in with any potency, then you can. It is better to go in that way. Better not to experiment other thing. That's what I would like to add to the. Anyway, congratulations, Doctor. I
Thank
think
you, sir.
Dr. Karnagar want to speak to
We
you.
have only 2 more minutes to go. Dr. Karnagar, you
Yeah.
can make it.
Yes, sir. It's a very nice, ma'am. You are dare enoughly accepting. I don't have any confidence on 50 millispatal potency. It is a very, very dare enough step. No one ready to accept it. What I have observed in my cases also, the hesitation of the patient can spoil the action of homeopathic medicines, ma'am. Everywhere they are ready to show their patients, but when they came to our homeopathic system of medicine, they want to immediate action. Even they himself observed there is a positive result after taking homeopathic medicine. Still they are in doubt position, and they are insisting the physician to show me a quick result like that. This hesitation make the physician to hesitate to change the medicine or potency or like that. Maybe sometimes it is also possible to spoil the case and the failures in homeopathy. Maybe what I have observed, ma'am. So this is also another important thing. So each and every drug, and also there was no support from the others. Even we have to refer to check either milestones are developed, how much there is a need to help as a psychiatrist or some other people, behavioral therapist or other thing. They are graded the how much possible result is there, but they are not interested to go. When allopathic physicians are stated that, immediately they are attended and take the report. When we want to say to go and take the report, we want to show our remedial action either positive or negative like that, but they are waiting, they are neglected. These are the two things. Maybe some amount more positive possible result in cases we fails to communicate to the public, maybe, I think. So thank you very much, ma'am. Your presentation is very nice and interaction is very good. Bindraj sir can get more information as a analytical base. Thank you very much, ma'am.
Sir, one thing is that we have to convince them, sir. Just ask them if you are not finding any improvement, and then why you came here, and ask them like symptom by symptom. We have to, as Hanuman said, maybe because my head is full of organ, like I am teaching organ on, I am going like that, because every time when the patient comes, I will ask each and every symptom again and again. How is she now? If there is seizures, how long it lasts? How many seizures came in last 2 weeks? And what you did? And is she responding? Is she looking at your face? Earlier, if it was she was not looking at your face for completely. Now, how many calls you have to call them? Or how many calls she will look at your face, like that, each and every symptom. When we ask symptom by symptom, I am sure that among 10 symptoms, at least 5 of them have results or will show results. So
Yes,
that
ma'am.
will,
Yes, ma'am. What you said is right. I am also organon teacher, ma'am. I explained the positive result, how I observed to every mother. Even though they said positive result is there, but they are insisting quick, how much time taken, doctor, doctor.
yeah,
This is
yeah,
the
true,
approach
true.
I
That
have
is
observed
there.
many patients.
Yeah, that is there. Yeah. I agree.
Thank you, Doctor. Thank you. And it's time to conclude the session. And I thank Dr. B.R. Bindu for this excellent session. Please come again with more cases, more promising cases. And I thank you all who were here, who presented here for this session. Over to Dr. Shaila for the Malayalam.